Good day, everyone. My name is Esnaira P. Sama, your presenter for today. I am part of the Group 5, and we were assigned to look for drugs or drug innovations that are used to treat diseases from the organs under the lower respiratory tract, like the lungs. My report for today is about Zenletta with the generic name of lefamulin. You can see the chemical structure and chemical name on the screen. Zenletta with the generic name of lefamulin is the novel antibiotic approved by FDA last August 19, 2019 for the treatment of community-acquired bacterial pneumonia. This antibiotic achieved early and effective clinical response against common CABP patients in as short as 5 days total therapy. So please don't be confused when I use CABP term instead of community-acquired bacterial pneumonia just to make it shorter. First, let's have some brief discussion about the community-acquired bacterial pneumonia. What is CABP? CABP is a type of lung infection. It can cause breathing problems and other symptoms. It is a community-acquired pneumonia. Therefore, you get infected in a community setting and not in a hospital, nursing home, or other healthcare center. It is actually one of the most common cause of hospitalizations and deaths in adults, especially the elderly. Who is at risk for common community-acquired pneumonia? Those people who are smoking, those with weak immune system, those people with underlying conditions, heavy alcohol users, and also those people who are coming in close contact with people who have the pneumonia. What are the symptoms? Symptoms include the shortness of breath, coughing, heavy sputum, fever and chills, chest pain, and nausea and vomiting, which is less likely to happen. But then your healthcare provider might notice other signs like fast heartbeat, fast rate of breathing, or specific sounds on a lung exam. It is usually a crackling sound on your lungs, heard by your doctor using stethoscope. How is community-acquired pneumonia diagnosed? By using the lab tests like chest x-ray, blood tests, blood culture tests, or test of your sputum. So let's go to the Zenletta or lefamulin, which is our main topic for today. FDA approves Zenletta lefamulin new antibiotic to treat community-acquired bacterial pneumonia. It is an antibiotic, first-in-class semi-synthetic fluoromethylene antibiotic, which is a derivative of natural product of oyster mushroom for systemic administration in humans, discovered and developed by Nabriva Therapeutics team. It is an antibiotic which is very good, which has a very good safety profile, and you don't have to compute for loading dose because uh, it is very good in terms of its pharmacodynamic and um, pharmacokinetic features. Zenletta is a semi-synthetic antibiotic agent for oral and intravenous administration. It is fluoromethylene, by the way, is a derivative of natural product of oyster mushroom. Zenletta is indicated for the treatment of adults with community-acquired bacterial pneumonia or CABP caused by susceptible microorganisms such as Streptococcus pneumoniae, Staphylococcus aureus, Haemophilus influenzae, Legionella pneumophila, Mycoplasma pneumoniae, and Chlamydophila pneumoniae. But then, of course, to reduce the development of drug-resistant bacteria and maintain the effectiveness of Zenletta and other antibacterial drugs, Zenletta should be used only to treat or prevent infections that are proven and strongly suspected to be caused by susceptible bacteria. This means that we have to perform needed lab tests or anything that can prove that there is a bacterial infection to avoid microbiotic resistance, which is a very problem in our profession nowadays. Dosage and administration of this drug: 150 milligrams every 12 hours by intravenous infusion over 60 minutes. But then you can switch to tablets to complete the treatment course if you can already swallow, or just it's more convenient to just go with tablet. You can continue. You can switch from an IV to tablets. Treatment duration is 5 to 7 days. As for tablets, you have to take 600 milligram tablets every 12 hours for 5 days. 5 days. Ibig sabihin po, you have to take it twice a day for 5 days. So you'll need 10 tablets. But please be cautious with patients with hepatic impairment, because instead of 2 times a day, you can only give 150 milligram infused over 60 minutes every 24 hours, which means you can only give it once a day. And tablets have not yet studied and not recommended for patients with moderate to severe hepatic impairment. Administration instruction for tablets: take at least 1 hour before a meal or 2 hours after a meal, and swallow the tablet whole with water. Do not crush or divide the tablets. We all know that antibiotics are more absorbable or more effective when they are taken when they are in an acidic environment. So you have to take it before a meal or 2 hours after a meal, just to make sure that the environment inside your stomach is acidic, which will make the drug more absorbable and of course more effective. Administration instruction for injection: administer Zenletta injection by intravenous infusion over 60 minutes. You must dilute it in a 250 ml solution of 10 mm citrate buffered 0.9% sodium chloride for injection, supplied with Zenletta injection before use. In case you missed a dose, you should take the dose as soon as possible, or any time up to 8 hours prior to the next scheduled dose. But then if you only have less than 8 hours remain, then do not take the missed dose and resume dosing at the next scheduled dose. Dosage forms and strength: we have talked about it earlier. There are 2 forms of Zenletta: the injection type and the tablet, which is 600 milligrams. Injection is 150 milligrams. Contraindication for patients that are taking Zenletta are those patients with known hypersensitivity to this drug, or fluoromethylene class drugs, or any other components. And please be cautious again with concomitant use of Zenletta tablets with CYP3A substrates that prolong the QT interval is contraindicated. For example, is the pimozide, as this may result in an increased plasma concentration of these drugs, leading to QT prolongation and cases of torsades. Warnings and precaution. QT prolongation, like we have briefly discussed it just a while ago: embryo-fetal toxicity and Clostridium difficile associated diarrhea. For QT prolongation, this drug causes QT prolongation in the ECG. So you have to avoid using this drug in patients with known prolongation of the QT interval, patients with ventricular arrhythmias including torsades, patients receiving antiarrhythmic agents, specifically the class 1A and class 3, patients receiving other drugs that prolong the QT interval such as antipsychotics, antidepressants, erythromycin, pimozide, moxifloxacin. This drug may cause fetal harm, so you have to advise females of reproductive potential of the potential risk to the fetus and to use effective contraception. Clostridium difficile associated diarrhea: you have to evaluate those patients that develop this CDAD. because it may range from mild to severe diarrhea, which is caused by the fatal colitis na, which will cause fatal colitis. Treatment with antibacterial agent alters the normal flora of the colon, leading to overgrowth of C. difficile or Clostridium difficile. If CDAD is suspected or confirmed, ongoing antibacterial drug use is not directed against the Clostridium difficile may need to be discontinued. Appropriate fluid and electrolyte management, protein supplementation, antibacterial drug treatment of Clostridium difficile, and surgical evaluation should be instituted as clinically indicated. Development of drug-resistant bacteria. We all know that we have this very big problem in our profession, which is the antimicrobial resistance. So prescribing Zenletta in the absence of a proven or strongly suspected bacterial infection or a prophylactic indication is unlikely to provide benefit to the patient and increase the risk of the development of drug-resistant bacteria. Like what we have mentioned earlier, you have to make sure we have to perform necessary tests to prove that it is a bacteria before using Zenletta, as it may cause antibacterial resistance. For the adverse reactions, most common adverse reactions are for Zenletta injection, administration site reactions, hepatic enzyme elevation, nausea, hypokalemia, insomnia, and headache. For the tablets, diarrhea, nausea, vomiting, and hepatic enzyme elevation. Treatment of overdose with Zenletta should consist of observation and general support measures. Lefamulin and its primary metabolites are not dialyzable. Clinical pharmacology. We will discuss the mechanism of action of this drug, its pharmacodynamics, and pharmacokinetics just briefly. Mechanism of action. Zenletta is a systemic fluoromethylene antibacterial. It inhibits bacterial protein synthesis interactions with the A and P sites of the peptidyl transferase center PTC in domain V of the 23S rRNA of the 50S subunit. The binding pocket of the bacterial ribosome closes around the methylene core for an induced fit that prevents correct positioning of the RNA. Zenletta, please take note of this. Zenletta is bactericidal in vitro against Streptococcus pneumoniae, Haemophilus influenzae, Mycoplasma pneumoniae, including macrolide-resistant strains. But then it is bacteriostatic against Staphylococcus aureus, Staphylococcus pyogenes at clinically relevant concentration. I'm sorry I did not italize the generic name. That's my fault. But please just think that it was italized because scientific name or bacterial name should be in an italized form. Zenletta is not active against Enterobacteriaceae and Pseudomonas aeruginosa. Interaction with other antibacterials. In vitro studies demonstrated no antagonism between Zenletta and other antibacterial drugs. Example is amikacin, azithromycin, aztreonam, ceftriaxone, levofloxacin, linezolid, meropenem, penicillin, tigecycline, trimethoprim, sulfamethoxazole, and vancomycin. But then take note of this one also. Zenletta has demonstrated synergy with in vitro with doxycycline against Staphylococcus aureus. So please remember that if you say synergistic, then it is 1 plus 1 is equals to 3. They are more effective together. Next, pharmacodynamics. The 24-hour free drug area under the curve to minimal inhibitory concentration ratio has been shown to be the best pharmacokinetic pharmacodynamic index for the antibacterial activity of lefamulin in animal infection models of Streptococcus pneumoniae and Streptococcus aureus pneumonia. The QTCF interval prolongation rates of Zenletta was evaluated using two randomized, double-blind, double-dummy active controlled moxifloxacin 400 mg once daily parallel group trials 1 and 2 in adult patients with CABP. A concentration-dependent QTC prolongation effect of Zenletta was observed. So this drug has the best pharmacodynamics and pharmacokinetics properties. For its pharmacokinetics, for the absorption, the mean oral bioavailability of Zenletta tablets is approximately 25%, and peak lefamulin plasma concentration occurs 0.88 to 2 hours after administration to healthy subjects. You have also to consider the effect of food. The concomitant administration of a single oral dose of 600 mg Zenletta tablets with a high-fat, high-calorie breakfast slightly reduce bioavailability. So this one, kaya po kanina, you have to take it 1 hour before a meal or 2 hours after a meal to make sure that it is more bioavailable, more absorbable, or more effective. For the distribution, mean plasma protein binding of lefamulin ranges from 94.8% to 97.1% in healthy adults. The mean steady-state volume of distribution of lefamulin is 86.1 liters in patient with CABP after administration of Zenletta injection. Metabolism, we have mentioned it earlier also that the Zenletta is metabolized by CYP3A4. Elimination, the mean total body clearance of lefamulin is 11.9 liters per hour in patients with CABP after Zenletta injection administration. Then the mean elimination half-life of lefamulin is approximately 8 hours in patients with CABP. So for elimination, we have to take note two things. The total body clearance of lefamulin is 11.9 liters per hour, and its elimination half-life is approximately 8 hours. For excretion, in healthy adult subjects, the mean percent of total radioactivity excreted in feces was 77.3% and 88.5%, and in urine was 15.5% and 5.3% following 150 mg IV or 600 mg oral Zenletta respectively. For specific population, there was no clinically significant differences in the pharmacokinetic of Zenletta were observed based on the age, sex, race, weight, or renal impairment, including patient receiving hemodialysis. Drug interaction studies effects of other drugs on the pharmacokinetics of lefamulin. Strong CYP3A inducers or GP inducers like oral rifampin reduce the mean lefamulin AUC and Cmax by 28% and 8% respectively. Since they are inducers, metabolism inducers, they metabolize the drug more in a faster rate, so giving the drug lesser time to be more absorbable and more effective. For the strong inhibitor, it will increase the mean of lefamulin area under the curve by 31% to 6%. So the same concept for what I have said a while ago. Strong CYP3A inhibitors, it will lower down the metabolism, which will give the drug more time to be absorbed and to be more bioavailable in our system. Interaction with other antimicrobials, it was already mentioned earlier, so I will not, it is my wrong, I wasn't able to erase this one. Then this was what I have mentioned earlier, a comparison between the monotherapy Zenletta versus moxifloxacin with or without the linezolid. Please put monotherapy Zenletta. I forgot to put it there. So here in our graph, you can see that the primary endpoint of these two comparison, like the Zenletta versus the moxifloxacin with or without the linezolid, is almost the same. But then in this table, in the first table, you have to take note that Zenletta was just, wait, they are the effect is almost the same, but then it for Zenletta it was only 5 days, while the moxifloxacin plus linezolid it was 7 to 10 days, if I am not mistaken. Wait lang, let me check it. Oh man. So this ends my report. For my references, this one, this one, this one, and this one. I hope you have learned something in my report for today. Thank